said, I'm the Executive Director of the St. Charles Foundation. We work with our community to help raise support for growing and innovating our healthcare in Central Oregon. And Todd's gonna talk with you specifically, which I know you're excited to hear about what's happening here in Redmond, what's happening at the hospital, what are those updates. So I'm gonna let him do that in just a moment. But another happy moment and another happy thought that I just wanted to make sure you all knew about. We're super excited because today is Todd Shields' 30th anniversary for working with St. Charles Health System.
Started when I was 2.
Started when he was 2. Yes. So today is the actual day, so I thought I had to make sure and acknowledge that. And so we all feel lucky we get to have Todd with us today. So I'm going to let Todd share a little bit about what's happening here at St. Charles and in Redmond, and then I'll close it up with a little bit of how everyone can help. So, Todd.
Well, thank you, Jenny. And thanks for allowing me to be here today. I can jump back there. And the funny thing is, everywhere I've gone today, it has been a bolo, be on the lookout for, and then a picture of me wanted. So they've had a good time with it today. So, but it's been an honor for me to be able to be at the hospital for 30 years and serve in a multitude of different roles. And I'll say I actually started as a radiology transporter, so one of the most entry-level positions possible, and worked my way up through imaging and to where I'm at today. So feel blessed to have that opportunity and to continue to support our communities that we serve. So I am really informal. Is it all right on the noise, the sound? Okay. So feel free to interrupt as we go through, and any questions, happy to answer. I am going to do a disclosure up front. We were in the news yesterday. How many of you saw that in the news? Okay, super important for us to not hide behind it, but to talk about it. And anytime you go to a community event, those things come up, and I want to be able to share what that looks like. So we did a strategic reduction in force yesterday, where 22 people were impacted that had jobs, and another 23 positions that we're not filling in leadership roles. Because we are growing so quickly and so rapidly, we need to adjust where we have those resources with all of the changes that are happening at the federal level. So I want to acknowledge it. It's always tough. It's painful. I have a colleague that has been there 27 years and her job was eliminated. So just want to acknowledge that, and hopefully we're able to find a spot in the health system for them to stay in a different role. So any questions on that before I go? Okay. All right. So a little bit about St. Charles. I'm trying to see which slide shows up here. So I think you guys know. Jenny, maybe we could switch, because then I can look at it. Is that all right? So we're 4 hospitals in the Tri-County. You guys know that. So we are Bend, Redmond, Madras, and Prineville. Those have come together over time. They used to be 4 independent hospitals, but now we work as a health system. We have more than 5,500 employees. We serve 32,000 square miles in Central and Eastern Oregon. We have a huge service area that we are responsible for. And Bend is the tertiary facility on this side of the Cascades. So in 2025, we had 188,000 different unique hospital patients. So that's every individual coming in. So that is a lot of patients. We saw 1.4 million total patient encounters. So you can do some math on how many times people maybe come back, and that's from hospitalization to doctor's appointment to a lab draw. Did a little over 16,000 radiation oncology visits and 36,000 medical oncology visits. And I think what's really important, why we highlighted that here today, is because of the advancements in what we've done here in Redmond with the Cancer Center that's most recently opened. So you all know what Central Oregon looks like and the demographics. And so there's our 4 hospitals, but I also want to call out, this is called Region 7. So it's a region through the state that we are responsible for as St. Charles. So with disaster preparedness, other things of that nature. And so Burns, John Day, and Lakeview right here, those are small critical access hospitals like Prineville and Madras, and they transfer a lot of patients to us into Bend. Actually, part of my job is also the liaison responsible for all of that region in Burns, John Day, and Lakeview, and I travel out there about every other month to each of those hospitals to see what can we do to keep their care local, but when they need us to transfer patients to us. So you can see we're the largest employer, provider, and healthcare purchaser in Central Oregon. I also want to say when I say that, we don't want to be the only one. You hear that like, oh, it's a monopoly. We need other people to come in to serve the region because we can't do it independently. And with the challenges that we have as a nonprofit, we will always see anyone that comes into our doors. You cannot turn people away. Doesn't matter how they pay. But what we're finding in some of the partnerships that we have in healthcare is any of the services that aren't profitable, they're not providing those anymore, some of our partners. And so that just falls onto the hospital and it makes it tough. So those are the things that you all see kind of in the news with a little bit of that background. So some of our essential impacts on Central Oregon, and we already talked about it. So this is our unique patients and the number. So you've seen it grow. So 171 in 23, in Jan 24, 173, 188. So a big pickup here, right, in this. I want to be transparent to say we also in last year in in 2025, February of 25, the center, the orthopedic center, came into St. Charles. So that's a pretty big business that came in. So that increases our numbers pretty significantly as well. The other thing I think is really important as we talk about hospitals and capacity is you can see we're pretty flat on the total number of hospitalized patients with discharges, okay? But we know that number is going to keep growing. So this morning, my phone rang at 4:30 for the first call because of a capacity constraint. So the 4 hospitals right now, so all of them, Bend has every bed full, 25 patients waiting in the emergency room for a bed. Redmond, every bed full. We have 7 patients waiting to either transfer to Bend or to go up to a room. Prineville, we have 12 beds upstairs, 4 beds in the ED, all 4 with 2 more patients waiting to transfer, and Madras is full. So just kind of where we're at right now and things that we're working on, because it takes time to build new beds. So we also need to, part of our mission, vision, and values is creating America's healthiest community together. So how do we keep people out of the hospitals? That's a really important part of the work we need to do and continue to do.
Is there any trend in why it's full?
A lot of seasonal. So this is pretty common seasonal as things go. We actually have struggled a little bit throughout the winter months because the Mount Bachelor didn't have a lot of snow. Our visitors went down, which is good for our patients because we didn't see nearly as many traumas, but our trauma numbers have significantly decreased. Now trauma numbers are going back up as people are coming back here to the region. So, which again, it's weird to say, we don't want those traumas, but you have those traumas year after year after year, you plan for it, and then when you see a reduction, you can't eliminate those expenses either, right? So we saw a significant decrease in trauma, so. Great question. So you can see, again, we've already talked about this on the employees, but I do think it's important to show that, we're 4.8% of the GDP here in Central Oregon, as well as 4.5 of employment. So pretty big footprint for us and really important, and then hard for us to have those conversations when we do have to do, strategic reductions based on kind of the needs of where we're going and what's growing. So let's talk about celebrating some recent accomplishments of what we've done. I can't wait till my accomplishment of getting my braces is 3 months out because I can say it then. So I haven't been drinking. I usually do that as a disclaimer. There's not been any drinking today. It's just sometimes my braces when I talk will make me start to slur. So one of the things that I really like to highlight, and you see this also in the public, is we have a lot of turnover. St. Charles can't retain folks or anything like that. We are at the top national 10th percentile for retention of caregivers and people. So, I think that's really important for us to call out. So there's a lot of tenure at St. Charles. We are able to recruit now. There was obviously a period of time during COVID when I'm sure all of you in some way were impacted in that work and, things changed, but super proud of this in decreasing turnover. Our biggest area of focus right now is first year turnover. 1, for making sure we hire the right people. 2, for the cost associated with turnover. And 3, just for that opportunity for you to build relationships with your caregivers and colleagues that you work with. So, but I like to celebrate this a lot, as you can see.
Is that blue line the vacancy rate?
Yep. Yeah.
The number of open positions or
Yep, so it's a vacancy rate of going down, and one of our lowest vacancy rates is nursing. So, which is great, but now we have to balance what that looks like too, because there are so many nursing programs out there, and we have an aging workforce, and you've got to figure out those new nurses coming in to get them the experience to help replace, the aging workforce. So it's kind of a delicate balance in where we're at right now. But we definitely continue to partner with the community colleges and the programs around. How do we retain or recruit and retain local individuals? So just some accomplishments we want to call out in 2025. So we already mentioned the center came over to St. Charles, and this was not something that St. Charles wanted to get involved in. When this business came over, it's a $10 million loss for us, okay? But we had to step up because they were not sustainable, and we have to have this service. We'd already seen one orthopedic group that has dissolved in town. And we need that, obviously, as a hospital for all those traumas, all that orthopedic work. So really focusing on driving this business here. We opened up our Mountain Medical Clinic. So this is one of my projects that I did. I did transition. I don't have urgent cares anymore, but this was my last project that I opened, is the Mountain Clinic. And we'll look to potentially expand that to make sure that we've got services where we need them. This is the hospice auction that we do in Prineville. I have a great time, and I have like 7 or 8 suits, Christmas suits. So during the season, I'll wear them, and people are like, it's embarrassing, but it's fun. This one is really cool. This is a program that Jenny and I are talking about tonight in Madras, a fundraiser event. This is our rural residency program in Madras. So we are doing a rural residency training program for physicians. It started in 2018, and it finally came to fruition. Very difficult. We have 3 residents now with a cohort. We have 3 more coming. So super, super excited to see this work go. And we just got a donation for an endowment. So to help build that, because it's not easy to do, and they cost a lot of money, and it's difficult, but it's super important and changes the culture. And also on that note, most residents stay within 50 miles of, or most residents stay within 50 miles of where they did their residency. So our goal is to help then, build that workforce with primary care, which is really important. Jenny's going to talk about the Cancer Center here in Redmond. I opened up a community pharmacy in Prineville, so as well as in Madras. So both of these were also things that I was part of last year in the communities that we serve. Some may say, why don't we have one in Redmond yet? So we used to have a pharmacy in Redmond. Right now, there is still access here in Redmond. And again, not a business or service we necessarily wanted to get into, but when I'm seeing an increase in people coming to the emergency department because they can't get their medications, they aren't going to wait in line at Safeway, because in Madras they went down to one pharmacy at Safeway, and people just weren't getting prescriptions. They were running out of medications. They were closed for staffing. So something that we got into, which was really important for us to do to serve that community. Okay, so keeping care local. So this is something I focus on every day. I had a little piece of paper.
Oh, you do.
So why I was a couple minutes late getting here, I was going to be here early. I was walking out, and I'm like, oh, wait, I can look at the timeline on the wall for some specific dates. So just a little bit about Redmond. So Redmond Hospital, so this was in 1941, okay? And it was a dental office. It was $20,000 was the first hospital, okay? So in 1951 then, the Redmond voters approved a bond for $435,000 on 20 acres of land where the hospital is now that was donated. So my Maybell Reynolds. And the vote was 464 approved to 193 that didn't. So in 1952, then the Central Oregon District Hospital opened with 31 beds and 4 bassinets and a staff of 30, okay? 1964, they expanded and put on a new OR. 1972, they added 2 ICU beds. 1982, new ED and the OR opened up. In 1983, they became accredited with the Joint Commission, which is a group that comes through, and for Bend and Redmond accredits is an accreditation group that they do every 3 years. kind of a survey, and we are in survey right now. So I just want them to come one Monday morning. They stay for a week, and they have about 10 surveyors come. It's pretty intense, but it's good. It helps to make sure we're aligned and doing the right things. And then in 1998, started the talks with Central Oregon District Hospital in St. Charles. 2001 was the merger, and in 2006, the new Geldwen Tower was built. So that's 20 years old right now. So it's kind of hard to believe that it's 20 years old. Okay, I'm going to go quick here. Yep. Jenny's turn.
Do you want me to talk about this?
Yes, please.
So as we all know, the new Redmond Cancer Center opened in April. Very excited, project that has been in the making for several years. That facility will see over 300 patients a day here for our northern community. So it was really determined that that facility would be for our residents in Redmond, as well as Madras, Sisters, Prineville, et cetera, to really decrease their commute if they were having to come in weekly, daily for different types of cancer treatment. It's 53,000 square feet. Significantly larger than the previous Redmond Cancer Center, if any of you had ever been in that tiny little space. So we're really, really proud of it. It's very beautiful, beautiful views of the mountains with 25 bays in the infusion room to provide that service. And some new services that have come to Redmond, radiation oncology. We built 2 vaults. Those are when you're driving down 97, those are the big gray boxes on that side, this side of the building. One of them has an operational vault where they administer radiation. The second vault is waiting for the future. So I was sharing with Elizabeth, this facility was very much built for the future. It probably will open about 75 to 80% at capacity, but lots of room to grow for a long time for this region. So we'll probably add another, Trubium accelerator, which administers the radiation. Maybe our cancer leaders think maybe in like 5-8 years, the volumes will be enough potentially that we need to add that second radiation room, but it's already built out because this is one of the most expensive, complicated things to build. So we're excited about that. Surgical oncology, we're providing breast, gynecological, reconstructive, all surgical care we're providing here. Integrative therapies like massage and Reiki. There's a high-risk clinic and the genetic counseling operations in that facility, expanded support services, and there's an on-site lab and an on-site pharmacy right there that's mixing and making the drugs needed right there on-site at Redmond. So really proud of that building. It's open, it's operational, it's going really well. Our cancer team looks at it as we're calling ourselves a cancer institute, so our doctors see patients at both facilities, at both Bend and at Redmond, and so that way they can meet patients where they're at. So we're really proud of that.
Yeah, I do want to clarify one thing as I spoke about pharmacy. So the pharmacy here isn't like an outpatient pharmacy. It's for the pharmaceuticals that are needed to treat the patients with chemo or other things.
Yeah.
So super excited, beautiful building.
Are there plans to expand the providers?
Oh, yeah.
there?
Oh, yeah.
And are you
Oh, yeah.
is it
Yes.
actively recruiting or it's just more of the plan?
Actively recruiting. So right now, I believe we have about 20 medical oncologists, radiology oncologists, surgical oncologists as a part of our team, and we are bringing new ones on every year. So they're actively recruiting and actively growing, and really growing in specialty areas around, urology or GI or those sorts of areas. We're happy. We have a reconstructive surgeon now on staff who can help in those areas. So really focusing on some of those specialty areas.
And what's hard sometimes when we're kind of at the size we are, when we just have one that does it, life changes for individuals and then they leave. So we're really trying to figure out how do we have services that aren't people dependent, but that we can really build a system around. And that's hard with kind of where we're at the stage. But that's a goal of ours to continue to do that, because it is our obligation and responsibility to provide services locally, so that are appropriate to be here.
I would say on behalf of our cancer team that we have world-class cancer doctors here. They're coming from all over the best like Todd said, they want to come here. They're excited about the opportunity to come to this beautiful region that we live in. They're trained at MD Anderson, they're trained at Stanford, they're trained at Johns Hopkins, all of the best universities coming here. We're really proud of it. And for the majority of cancer services, everyone should feel like they're getting the best treatment available here in Central Oregon. We want to keep people here local as much as possible. And when we need to, when there's cases that are so specific and so complicated or rare, we will reach out to our colleagues, maybe over at OHSU or other facilities, and coordinate that care. But the majority of cancer services, we're really proud to take care of those here in Central Oregon.
Yeah, it shouldn't just be a transaction. It should be, focusing on the mind, body, and the spirit, and really keeping it local, because we also know people heal better when they have people around them that help support them through that phase of transition. Okay, this is a really busy slide, and I talk about this all the time. I will go very high level here, but it's about keeping care local. So one of the changes that happened about I guess October of last year was a restructure. So again, I used to be Prineville 7 years ago, then Prineville Madras, now Prineville Madras Redmond. And it was our new CEO who actually starts on July 6th. He's been with us a year, but really thinking and seeing from an outside perspective of, gosh, these three hospitals on the northern have a lot in common, but yet, everything is driven by Bend because it's so much bigger. So how do we focus on the northern campuses and build some synergy around that? So hence the restructure. And I talk about keeping care local. Again, what's appropriate to do in our communities, we should do. So I'm going to go to Prineville, for instance. If we can do a service in Prineville and it makes sense, we should keep that patient there. But if that patient needs to go to a higher level of care, I want them to come to Redmond first, and we should have those services. And then if we can't have those services in Redmond, then they go to Bend. We need to think as a system of how we move patients throughout. So a lot of work around that. So some specifics here is I'm working to maximize our OR. So our OR utilization is we need this to really be humming. This is an important part of how we support our community, and also of how we physically or financially can support the community. This is kind of the important spokes of the wheel there. So we're bringing urology in, we have robotics, we are bringing orthopedics back here now. We have 2 new providers that are coming to do surgery here, going to do some total joints here that we haven't in a long time. Added some new block time for gynecology. So these are truly things that are all in the works right now. So additional providers coming. And so to your point, we're recruiting in different areas. And within this group, there's about 7 different providers that are coming to do work here in Redmond. ED, I talked about the number of patients that are boarding. We have a small ED. We need to expand that ED, but we also need to make sure people are right care, right time, right location for the right cost. So a lot of people come to the ED that don't need to go to the ED probably, and so working through some elements and work there.
Is that emergency?
That's emergency. Yeah, sorry. Thank you. Emergency department. Really also growing our inpatient specialty coverage. So we have beds and capacity in Redmond often. Bend is full, but people have to be transferred for a consult because we don't have cardiology or different services that they need to be seen as an inpatient. So we actually, on September 28th, we have cardiology that will be an inpatient now here in Redmond. So non-invasive cardiology, we anticipate that will decrease about 10 transfers almost per kind of in a week period, and we will have people staying from the northern campuses here to get that cardiology service. And it's going to be the docs that are going to be rotating from Bend and Redmond. The other is we'll be doing echo now, additional echo. So right now it's 4 months to get an echo. Not okay. We need to decrease that. We got 2 additional echo machines. One goes into service on July 6th, and then the other one will go in August. So we'll be able to cut that down and also not have to transfer patients again to Bend to have some of these different procedures. So those are just a couple of the high level areas that we're working on that I'm pretty excited about.
Are we ever going to have baby delivery back here?
I knew it was coming. I knew it was coming.
I knew you probably have an answer to that.
Yeah. I do not believe we will have delivery, family birthing delivery here again in the near future. So
Say here, you mean Redmond?
in Redmond, yes, sorry. We only have, we deliver babies in Bend and we deliver babies in Madras. And it was a strategic decision in that we were at about 50% or less in capacity here, and it's a it's a hard service to continue to maintain. So like in Madras, we needed it there with the distance between because we'd have terrible outcomes. So we are committed to continuing those 2 locations and making sure that we have capacity. And that's our biggest challenge now is the capacity as we continue to grow. But we're really growing with a higher demographic of older folks per se than deliveries. So it was hard for that to go away. I remember it. I wasn't at the level of leadership that I am at now, but it comes up all the time. And it is still empty in that space because we have a temporary waiver through 2028 for that closure. So maternity wings and maternity care is closing, like Burns, John Day, Lakeview. They're at risk of closing. So another thing we're working on in Oregon is all of the hospitals that deliver care will receive some additional funding to help maintain that service because they can't recruit providers. John Day has 25 babies a year, so also then keeping your skills set up, having providers on call 24/7, have to go into an emergency C-section with a surgeon. I mean, there's a lot of things and challenges with that. So, did that answer your question? Okay. What's on the horizon? So, I think it's kind of interesting when I pulled the dates of some things. It kind of goes in 10-year increments, right? And I missed a lot of things in here, but kind of in those phases of where we're at. And what I'm really excited about, I'm going to say it publicly. I feel like Redmond's always been kind of the stepchild of the health system for a period of time because Bend is so big, right? And things are driven there and you have to do it how Bend does it. And again, now that we've changed things, I think we have an opportunity to show the great care that we provide here and then the services that we can do. We have great patient satisfaction scores. We have really high retention, of our caregivers and all of those things. So we're really focusing on that. And I believe that we will see a significant investment in Redmond campus in the next 3 years. So we will be going to the bond market, most likely, so I'm being cautious here, for a pretty significant amount of money because for me to expand or do anything additional in Redmond, the facility is old. I gave you some dates. It's the original CUP, Central Utility Plant. And for us to upgrade to where we need to be, the original proposal that came to me was $58 million for the Central Utility Plant. We got it down to $28 million now, so I felt much better about that. It's hard because that's a big investment, but doesn't increase any additional revenue or space. But we have to do that before we can expand our emergency department, which will be about $4 million in that expansion. And then to do the family birthing space, that old space that's 14,000 square feet, we have to do the cut first, and that itself will be about another $7 to $9 million. And then we are planning to build a medical office building here in Redmond. So when I start to put numbers together, I'm pretty close to $100 million of what we need to do. So it even goes back to that, what happened yesterday. We have to make sure we're really good financial stewards so that we can continue to invest in our communities and the services needed. Okay. And you know what? What's really cool, I loved seeing this today. 30 years ago today, I actually met Sister Catherine in my orientation. It was pretty awesome, pretty amazing, pretty impactful. I worked with her for multiple years as she kind of was transitioning out. But it was pretty cool to see that. So you got this? Yes, please.
I'll take it home. Thanks, Todd. So we're really, Todd talked a ton about space constraints, the population growth, the tourism that we're seeing here, the finance models to be able to keep up with facilities. It's not so much in recruiting or doctors, or it's the facilities and the space that are really weighing on our minds. So we estimate by 2050 that we need to deliver roughly 2/3 more care than we do today. Almost, right? Like doubling. So 60% more hospital beds, 85% emergency department capacity, 50% more operating suites and space, and at least 50% more ambulatory clinics. So the leaders, our foundation, are getting really, really engaged. And how do we do this? How do we map this out for the next decade, for the next, all the way till 2050? And how do we put that together financially? And so the St. Charles Foundation, that's where we come in. The group that I work with and lead and our board of directors are really focused on raising funds and philanthropy from our community for people that are inspired by this vision, that want to help support healthcare, want to help support our community. St. Charles is a nonprofit health system, and really like operating and functional is in this environment is like really, really good. Now, how do we talk about innovation, growth, expansion? That means the philanthropy needs to be the differentiator there. So we go out, we've created an incredible campaign. It's a very aggressive, ambitious campaign. Over the next 7 to 10 years, our foundation would like to raise $135 million from this region, from this community. That's through private philanthropists, foundations, corporations, civic groups, organizations that will help in the areas that they feel most passionate about. We believe it's going to cost over $1 billion to achieve all of the growth that Todd and I have been speaking about. And so we don't expect philanthropy to pay for all of it, but if we can get involved and help a little bit, it's going to make it that much easier. So we're focused on building the new hospitals, building the new emergency departments, focused on rural health and growing those programs. We'd love to have eventually a new NICU, those kinds of services here for our region. So these are some of the areas that we're focused on. And if you have any thoughts, any ideas, people that you think that we should be talking to, if you know people that can make a gift, a transformational gift, want to think about their estate planning or leaving a legacy, please have them reach out to us at the foundation. We'd love to work with them on that. Locally, there's some fun stuff we're doing. I don't know if you all know about Heaven Can Wait. How many people have ever been to Heaven Can Wait? Okay, good. So this is our annual 5K walk run that takes place here in Redmond at Redmond High School. It's in October. It's to support breast cancer patients and our breast cancer programs. Really, really fun community event. We had about 1,300 people participate last year. We would love everyone. Registration's open online. We create a team, get a group together, come out on this really fun Sunday morning and support breast cancer patients. So that's one way. And of course, just continue to reach out to us if you have questions. Spread the word with your friends and neighbors that St. Charles is, looking for support. We're hoping to grow. And yeah, that's it. So I don't know how much time you guys have. It's 1 o'clock.
Yes, Mr. Volunteer at St. Charles Gift Store.
How much charity care does it cost the hospital between those that are uninsured and what support services?
Charity care is significant. Oregon is one of the highest areas for charity care because we get paid 4 ways. You get paid by Medicare, Medicaid, commercial insurance, and self-pay. And the only one that covers the cost is commercial insurance, and commercial insurance is 18% of our patients that have commercial insurance for the region. So we're really heavily relying on Medicare and Medicaid, and we do a lot of charity care. The number I don't have specific. It's in the multi.
It's north of $100 million.
So annual, yes.
Annually.
Yeah, and there was a new law that was put into place last year that even changed it more. And now that's been kind of pulled back because it was a little over the top. I mean, anyone was qualifying for it, and you didn't have to even show certain things. And so the Hospital Association really helped to bring that back together because we want to provide the care, and we need to provide that care, but we need to not always do it for free. Yeah. So we have people that come into the emergency department sometimes 2, 3, 4, 5, 10 times a week, the same people, because that's just where they need to come. So, and then we hold patients until they're discharged because we don't have good discharge plans here in Central Oregon with skilled nursing facilities or locations, behavioral health challenges, things like that. So that's why Rimrock is so important in some of the work we do there, for sure.
Yes. Every now and then you hear people make the comment that they can't recruit medical professionals to come here because the price of real estate is so high. Do you hear that in reality? Yeah,
we do have that challenge, obviously. And what's always interesting to me is how we hear it kind of at the higher levels of compensation for some of the providers or nurses. Where I really worry about it is the individuals that are and critical to the hospital around environmental services, food services, those others. So we do struggle with that, and that's why we do have to be very, very competitive in our
The
compensation.
other thing is with recruiting providers, where I spend a lot of time thinking about is the kinds of equipment and technology that they're trained on at the institutions they're training at. They do not want to come to a health system or a region that is not up to speed on the latest and greatest technology and equipment, and that is very, very expensive. So that is actually an area that the foundation gets involved in a lot, helping provide the latest cardiology equipment or robotics that those surgeons or doctors are trained.
New Mako coming soon, hopefully. Sorry, I had to do a public little push for it. So.
Okay.
Yeah.
So Victoria and I are ambassadors for the Heaven Can Wait, so maybe we'll develop a Kiwanis team to walk and get out of tutus and wear tutus, and men are invited and women.
No, we're done.
Perfect.
Thank you.
Yes, thank you guys. Sorry we went over.
Oh, pictures.
We can take pictures.
Okay.
Maybe you could, yeah.
And you get the special.
Oh, thank you. I love pens.
I think
We don't want to be in the front
front
of
one.
the questions.
Oh.
The slide.
There we go.
Okay.
Oh, here we go.
Very good. Thank you.
Awesome.
Thank you very much.
Yeah, thank you.
Oh, thank
Appreciate
you.
all the
Thank
work
you
you
so
guys
much.
do.